Awesome. You're good to go.
Okay, welcome everybody. This is the always somewhat awkward webinar thing where I know there's people out there and I'm talking into the void, but we're glad to have you, and hopefully someday we'll all meet in person as well. But this affords us the opportunity to reach across state lines, which I think is super important. In fact, it's important because that's what we are. We're the New England Children's Behavioral Health Network, which is a mouthful. Basically, this is an organization that's been around for a few years, but was formally incorporated as a nonprofit just this year. Its goal, and we can see the next slide here, is really to improve behavioral health for kids and families across New England, which is an incredible part of the country. I didn't grow up here, but I've lived here my entire adult life. And I'm never done learning about it. And that's what this meeting and this organization is all about. To do this, we need to promote preventive, equitable, accessible, and family-centered systems of care to serve as, pardon the medical term, a connective tissue for children's behavioral health stakeholders. That's actually what's pretty cool about this. That's academic centers, that's policy centers, that's state centers, that's individual practitioners. That's all of you who've shown up for this webinar as well. By doing this, we'll foster collaboration, networking across state lines, and we're going to look at things that work, maybe tweak the things that aren't working so well, and most importantly, work with systems, because none of this stuff happens in a vacuum. It's always in multiple arenas, which is what's so fun about these organizations. That's what we are. Happy to take questions about that when we get near the end. But today we have a treat. We're going to talk about fatherhood, which is, I think, geez, I've always been, let me introduce myself. My name is Steve Schlossman. I'm the Chief of Child Psychiatry at the University of Vermont. I'm an associate professor here of psychiatry. I'm also a practicing child psychiatrist, always been interested in dads and fathers because I'm a dad. I've got two daughters, 25 and 23. It's a weird time to be a dad. Not it's a great time. Being a dad is awesome, but it's something that doesn't always get the attention that it needs. I think in part because there's been a kind of understandable increased attention to other aspects of the family. When I told my wife this morning, I was telling our participants I'm going to do this thing on fatherhood today. She said, "Aren't you guys tired of talking about men? Like, isn't it time we talk about like the rest of the family?" I said, "We can do both." So this is our opportunity to talk about dads, but dads in relationship to the family and what their roles are. We have a great lineup. I'm going to let them introduce themselves. We'll go through the slides and we'll have time for questions at the end. Sounds good.
Awesome.
So,
Thank you,
yeah, I'm
Dr.
sorry.
Steve.
First speaker, go for it. Sorry.
Yeah, no, thank you, Dr. Steve. Good afternoon. I'm Tony Judkins. I'm a program manager at the Connecticut Department of Social Services, where I'm responsible for the administration of the Connecticut Fatherhood Initiative. I want to first thank Ash for inviting Connecticut to be a part of today's important conversation. We're truly honored to share a high-level overview of our state's approach to supporting fathers and their families. Connecticut's Fatherhood Initiative is built on a unique and enduring model that began in 1999. And over the past 26 years, we've worked diligently to strengthen and expand this really collaborative effort. And we're always excited to share what we've learned along the way. And by the way, before I get too deep, you guys will be provided copies of our presentation and other supplementary handouts that we'll reference throughout the presentation. Our hope is that today's presentation not only informs you, but the progress that we've made, it also inspires you to explore the possibilities in your own work. We encourage you to dive in, stay engaged, and help us move this work forward. Before I dive in, though, any deeper, I just want to emphasize that the Connecticut Fatherhood Initiative is not about prioritizing fathers at the expense of mothers. So that's going back to what Dr. Steve was saying in his conversation with his wife. At the heart of our work are children. And we believe the best way to support them is by supporting both their parents, whether they live together or apart, so they can be consistent forces in the lives of their children. The Connecticut or the CFI, right? We fondly call the Connecticut Father Initiative the CFI. The CFI is a multi-agency private-public collaborative led by the Connecticut Department of Social Services. It serves as an umbrella under which all fatherhood efforts within and across agencies fall. And what this really means is that there's one unified Connecticut Fatherhood Initiative, not multiple disconnected efforts. While each partner agency may run its own fatherhood-related programs or services, all of those efforts are coordinated under the umbrella of the CFI. This structure really helps us ensure consistency and alignment of shared goals and across our agencies. It reduces confusion for families and providers by presenting a cohesive statewide approach. All right, this slide highlights the core structure of the mission, the core structure and the mission of the CFI. Since 1999, the CFI has brought together a broad coalition of state and local partners under the leadership of the Department of Social Services. Our shared goals is to support children by recognizing and strengthening the roles of fathers, and that's whether they are currently parenting or preparing to step into that role. We believe that when fathers are engaged in healthy, supportive ways, it really not only benefits the children, but also mothers, families, and the community as a whole. CFI partners do this work on two levels, right? We have systems change, which includes shifting policies, practices, and organizational culture to be more inclusive of fathers, and through direct services, which provides hands-on supports to fathers in areas like parenting, employment, reentry. All of this work is really grounded in a strong commitment to racial and gender equity and safe engagement of fathers with their children. Okay, this slide is representing the legislation that really got it all started in Connecticut. Public Act 99-193 was truly a landmark fatherhood legislation. Connecticut was the first state to pass legislation focused specifically on fatherhood. While other states had governors, commissions, and councils, none legislatively mandated this work. The late Representative John Martinez of New Haven was a driving force behind this legislation. Along other key leaders, he championed this nonpartisan effort to address the growing impact of father absence on children. The legislation was comprehensive and instructive. It designated the Department of Social Services as the lead agency. It established a fatherhood council, and it launched a research and demonstration program with 3 pilot sites focused on father engagement from different perspectives. Fathers of children under the age of 5, a workforce development model, and incarcerated fathers. Next slide, please. So over time, the original legislation that established the CFI lost some of its strength and no longer accurately reflected the collaborative nature of the work that was being done. Recognizing this, in 2022, the CFI partners came together to draft a new legislative proposal. DSS, as lead agency, submitted on behalf of the CFI, and it passed successfully as Public Act 22-138, as you can see here. This updated legislation better represents the current structure, goals, and partnerships of the initiative. It also formalizes the expectations of partner agencies, including their active participation on our council or at events and activities, and the implementation of our strategic plan, as well as in collaborative funding efforts. But more importantly, it reaffirms the shared commitment of all partners to improving how fathers are acknowledged, included, and supported across systems that serve families in Connecticut. Next slide. So the Department of Social Services is designated as a lead agency through our legislation, and as such, our commissioner was tasked with convening a broad-based advisory council to guide the planning and implementation of statewide fatherhood efforts. However, DSS has really never approached this as a solo effort. From the beginning, this has been a systems change initiative, right? And the active engagement of both our state and local partners have been essential in its success. While the legislation initially brought partners together, it's been the strong relationships and shared commitment that has sustained this work over the past 26 years. The council first met in the fall of 1999. Today, it continues to thrive, representing a diverse and dedicated group of stakeholders from across systems that serve fathers, children, co-parents, and families throughout Connecticut. Next slide. This slide highlights some of the key strategies that has helped us sustain and grow the CFI over the years. Our foundation is rooted in legislation that emphasizes collaboration across agencies or across systems. From the beginning, we've taken a systems change approach, working to shift culture, policies, procedures, and interagency practices to better support fathers and families. We've prioritized racial and gender equity, and we've been very intentional about ensuring safe engagement of fathers with their children, especially in partnership with organizations like the Connecticut Coalition Against Domestic Violence and the Connecticut Department of Children and Families. One of the most important tools in our work has been our interagency fatherhood MOU. The MOU really formalizes the commitment of multiple state agencies to this work. And Diana will share more about this amazing tool when she's up on the mic. And finally, our strategic plan has really provided us with a roadmap for long-term impact, really helping us align our efforts and identify potential opportunities and really staying focused on sustainable growth. And so I think this is a good point for me to stop, and then I'll turn it over to Diana to continue the presentation.
Thanks, Tony. Good afternoon, everybody. I'm Diana DeTuno. I'm with the Department of Social Services Office of Organizational and Skill Development, where I'm a senior educational program manager, and I support the work that we do, the department does, in the leadership for the Connecticut Fatherhood Initiative. So Tony and I are a little tag team at the Department for Fatherhood. I'm going to talk a little bit about a sustainability strategy for us that Tony just mentioned, our Fatherhood Memorandum of Agreement or of Understanding. So the MOU was created with a lot of intent behind it by about 5 leaders who were getting together to run a workshop about how folks can bring such an infrastructure that Connecticut has to their own states. And as they were developing this, they said, do we have an MOU? And this is the way that state level partners can get together and ensure that with ongoing structural movement in state government, for us, it was 2006 elections and ever since when this MOU first came to be. And they said, we should create this so no matter who is in the top seats, we have something that we know that we are committed to doing and working together on. It provides a blueprint for commissioners of our executive branch agencies, the leaders of our judicial branch agencies, and even our state educational systems to keep those entities moving in the same positive direction around father engagement, right? This is regardless in changes to top leadership. It also provides an ongoing legitimacy for the collaborative intent of our legislation. As Tony said, because the legislation was sort of watered down over the years, the CFI Council and the leaders around that table said, you know, we need to put in a proposal to beef that language back up and really reflect what we're doing here. This is really a collaborative effort. We cannot work in bubbles. We cannot handle everything. We have our own expertise in our relative agencies, and so we want to make sure that the collaborative intent is there. It also demonstrates how we can support this work with limited costs. The systems changes our foundation. It is still the beef of what we do, that meat that holds us together. Okay, next slide, please. The MOU has now 15 partners, including the Department of Social Services, which we are the keepers of the MOU, and we have our council and those parties that are in the MOU and those leaders that sit in those seats to look through what they've agreed to do. And we do this annual review of the MOU to add bullets or to change and edit as we see fit. We have common bullets that all parties agree to, and then have each agency agreeing to do certain things under their individual scopes of service within the agreement. And what we are doing is also an annual report that we then send over to the legislature to say, here's what the Connecticut Fatherhood Initiative partners are doing, at least the MOU partners. Here's how we have made sure to do the work within our own walls and across agency walls. We will share the MOU if anybody does want to see it. It just needs to be a request to us. It's currently had been reviewed and it's under signature now. So as soon as it's executed, we can support that. So I'm going to turn it over quickly to one of our both MOU partners and longstanding CFI partners, and let her speak to our partnership under the CFI.
Great. Thank you very much, Diana. And thank you for having me here today, everyone. My name's Kelly Edwards, and I'm a program manager under prevention and health promotion at the Department of Mental Health and Addiction Services. So many words. Sorry about that. One of the best parts of my job, which is grounded in suicide and substance use prevention, mainly focusing on youth under the age of or 18 and under, is the Prevention in Fatherhood partnership that we are doing here at DMIS under that CFI umbrella that Diana and Tony were talking about. So we, through our department, fund a 0.5 FTE case manager at 8 different agencies across our state. Those agencies have been certified through the Department of Social Services for having certain standards. And what we're doing is we are paying for the case managers their time, but also we are training them in substance use prevention. And we're training the case managers to know drug and alcohol facts, mental health facts, trends that are happening with young people in our state, risk and protective factors as to why some of those substance use issues are occurring, so that then the case managers at each agency can then impart this information, this knowledge, and the skills to communicate with their children, with the dads in their groups and in their agencies. So it's kind of a lot of training that is happening, a lot of understanding, and a lot of working together actually as a cohort to learn from one another and to find the best ways to implement and share this information with dads. Because in my way too many years to admit time here in prevention, we notoriously have not been able to reach dads effectively. And all of the research, just like any other research you all have undergone about dads, is when the dads are more engaged and the dads are having conversations with their youth about prevention, the young people are much healthier, less episodes of depression and anxiety, suicide rates are lower, and substance use is lower. So this to us was a very obvious partnership. And so far, so good. It's seemingly working well. I actually see some of our case managers are on the call right now, so I know that they're supportive of this whole initiative. So you can see on the slide, we're doing QPR, which is a suicide prevention. We're training them on Narcan, and then the agencies can then provide these same trainings to their fathers. So, if they're seeing 400 dads a year, then that's 400 dads more than we had seen in prevention land before this. So, we encourage within our work in prevention and also within DMIS, what are the lenses that we have not been looking through to look for dads and to provide opportunities for dads and to include them in all of the different educational trainings that we're doing. So we're really proud to be part of this effort. We've been able to actually showcase it nationwide, and all of you in New England have prevention organizations out there. So if you'd like to reach out after this and I can help you connect with some of the prevention people if you like this idea, I'm happy to make that connection for you. And that's it.
Thanks, Kelly. Next slide, please. So another sustainability strategy for us is our strategic plan. And this plan was developed over an 18-month period in 2013 to 2015. We launched it in 2016. And I know strategic plans are usually 5 years and then you kind of get together and do this again. But we had over 50 agencies, over 80 individuals represented in the development of the plan, including fathers and mothers who were, well, I should say, in it. And in addition to that, we ran focus groups of parents, moms and dads, to make sure that what we thought we should look at with regard to how to better support men in our systems and children and mothers, we were on the right track. And so we had those findings and we rolled it into this plan. We're still working on this plan. There's so much work to do. And it's very active. We have 5 active committees plus a work group that has representation from all the different 5 domain committees. The strategic plan provides recommendations for service delivery system, and also provides short and long-term strategies to address all of these challenges that we've had with program and policy and our dads as they move through our system and their engagement with their children. It expands our promising practices and establishes new partnerships and strengthens those existing partnerships that we've had. We've had an awful lot of additional agencies come on board since we first launched. And, COVID stopped us all, but then we got right back on track because those dads were in need just like everyone else in our state during that time. And so we had to look at how did we serve our folks during that difficult time, and how are we going to move forward with better practices. We do have a handout of the strategic plan to give you more information. We don't have time to go into detail today. But in the next slide does share one of the products from the Domain 5 Committee, which is Public Policy and Awareness. And it's our messaging campaign. It's an annual campaign called the CFI Dear Dad Tour. You can access it when you get the slides. You'll be able to click on the link and access that website that holds all these videos that we've done. And it is an annual public awareness campaign that we run as a video booth tour. People can come into the booth and record stories about themselves as dads, about their partners as dads, about their dads as dads. So some children have actually done some recordings that are pretty funny. It could be grandparents. It could be a father figure, a family man who served in that kind of paternal role, anybody who has provided this support. And actually, we've had some pretty hard stories too, right? They can share anything they want to share. And this way they know that dads make an impact positively or sometimes negatively, depending on what that looks like. And so a lot of our providers will use these snippets in their own work with dads in their programs to sort of share that message, right? How critical are you in the life of your child, right? Next slide, please. Yes, so the Connecticut Fatherhood Initiative website, you'll also be able to click into this link and get to all of the work. You'll be able to read more about our history, all the things that we have. The legislation is there, although we also provide it as handouts to you that will come with the package. There's some media we've done, and also more information about the past reports and things that we've had done in our state through our initiative. Next slide. I'm really trying to get it all in within the 25 minutes, which I have probably 30 seconds left. We learned a lot of lessons here. The primary one I'm going to say again is the children are the center of our work. And anytime we're talking about how to better support men, we want to start with the language we use. We don't get distracted. If we get limited support or what might seem like limited support, we keep the work moving because it's relational, right? You've got to work across those agencies and see where you can come together. We found our common ground. We have a clear vision, and we can find what's in it for me, right? The WIFMs. Every agency and every leader has been able to do that. And we can do this sometimes with very little money for the systems change work. Next slide. For you all, food for thought, as you're moving forward in your respective states, think about who are the partners with whom you connect or could connect to support father engagement, right? I don't want to ever assume that and I can't see any of you beautiful people, but I don't want to ever assume that you're not already doing some of this work. But so really thinking about what points have I been really good at engaging the men who are fathers in my work? And are there points that I identify if they haven't, that would be easy sort of ins into that engagement. And how will you enhance your current practice to better engage fathers, right? When we first started this work, lots of women around a table in human services, right? And I'm in full support. I'm a woman in the work. I'm needed in the work, but I shouldn't lead the work. Men need to lead the work. And so, how do we make sure that the folks around the table are reflective of who we're saying we're serving? How are we making sure we're getting the voices of the fathers in the room, right? And then what, if any, challenges do you foresee in doing this work, right? And how will you address them? These are all the things to think about as you're thinking about how you could do some of this work in your own states. So that's just a little food for thought, and thank you very much. We're going to pass it on to our colleagues in Rhode Island.
All right. Thank you so much, Diana. Thank you all for having me. My name is Dr. Silas Copeland. It's a pleasure to be here and talk this subject with my esteemed colleagues as well. We are following actually Connecticut's blueprint, so it's great to be able to follow that state who have done so much in this work. Rhode Island is really looking particularly at these four predictors in terms of father involvement. Our focus, myself working with our Department of Children, Youth, and Families, our focus is really working and bridging the gap with the community and bringing that awareness and raising the awareness. And we know that in order for us to do that, systems have to come into place. So a big component for us, what's awesome about this webinar is that you'll see from Connecticut's viewpoint of being sort of at the top and with the blueprint in Rhode Island and how we are now formulating and building up our systems. Just like Diana touched on, a lot of the work is being done, but sometimes we just don't know, one, how to get that out there that is being done, and two, really how to come together for a plan. So what I'm going to touch on along with my colleague following is that father involvement, the increase in father involvement, what does that look like? And these are the benefits that we can see as indicators on what exactly the increase of father involvement will traject. So if you are at a state or if you are at a program where you are being met with some resistance around what's the importance with fathers, right? Because like we all said, there's a lot of different initiatives. There's a lot of things to focus on. However, in looking directly at what those increased father involvement, we've now brought in other state agencies along with the Department of Children, Youth, and Family. We have a very strong community presence now with our other folks who look at, again, the positive co-parenting relationship. So when you look at that piece, that's bringing moms into the fold. That's showing that fathers have a lot to offer besides that monetary support. And even though a relationship ends, that doesn't mean that that relationship and those resources can't still be used within the father's side. We've also know that financial stability. So one of the ways that we in Rhode Island have sort of attacked that piece with financial stability is really working with our Department of Labor and Training, bringing them into the fold where they can offer training support and they're able to offer job opportunities, and not just job opportunities that are going to be short term, but really helping fathers find a career path, helping them with resume building, helping them with being able to be prepared for interviews, prepping them for important interviews and looking at what their skill sets are along with their futuristic goals and tying that in with their relationship with their kids. So that is one link that we have started along the lines of that financial stability. When we talk about the reduction of risk and criminal behavior, we've partnered with our Department of Corrections. What they've been offering and sort of what we've worked together on is one, if there is a father who becomes incarcerated, how do we continue to keep that relationship with their children strong? Or is there a relationship that needs to be repaired? So, in connection with us working with those families and those fathers specifically, we've been working at offering programming that really starts within as they're housed at the DLC and connecting them with the community so that as they transition out, we're able to continue that support and able to continue to bridge those gaps within the community. And then lastly, the parenting confidence, knowledge, and skills. That has been really a major key that we at the department have really took on as our big project in terms of father involvement and really trying to allow fathers to gain confidence. Doing that by connecting them with lots of resources within the state, which my colleague, who I'm going to allow to come in and bridge on his role in terms of wellness and what that looks like in his community involvement, that ties in our positive co-parenting relationship as well as our parenting confidence, knowledge, and skills.
Thank you, Dr. Copeland. My name is Tyrone Jackson. I work here as the wellness coordinator at Department of Children, Youth, and Family. But I must also add, I was born into this fatherhood work through Parent Support Network of Rhode Island. And at Parent Support Network of Rhode Island, we have a group there called Father to Father, or F to F. And that is an extraordinary support group for fathers. Since I've been there for about 4 years, I've seen fathers come in very angry, very upset, very disturbed, and to some degree, one might say even traumatized because they've had their children taken away from them. And the change that I've seen with fathers, working with fathers to understand their process and what they can do, not only in support of themselves. So when we talk about wellness, we're also talking about the wellness of these fathers who are struggling and may not understand why they're in the position, looking on the outside. You know, they're sending their child support in, and in some cases it's exorbitant, and they only get to see their children maybe 2 hours a week. So we're creating an unwell society by having these fathers not be able to participate on the level where they authentically can, not only as supporting their family, co-parenting, and even from the point of co-parenting, they may strengthen the relationship between their children and their mother. So the importance of supporting fathers also is we're supporting mothers as well by creating families that have two caregivers if they're living together or not. And by supporting fathers and creating that wellness for themselves, their children, their family, it goes off to the community. And then in turn, we're creating leaders that we might not have seen come into the communities to help lift up communities and establish new gateways for other fathers who are having struggles coming forward. So although we're talking about fathers, we're really talking about society as a whole. And the initiatives of the Rhode Island Fatherhood Initiative and CTI is really to create a well society by supporting fathers, where fathers, dads feel as though they are second-class citizens, they're not appreciated. And I've heard this statement more than once that society sees us as the wallet. We're here to pay, but we're not here to really to have that relationship with our families, children, and perhaps even through having our relationship with our children, we will mend some families that would not be mended otherwise. So this is really an aspect of wellness as well as support for fathers, which in turn supports the whole family. So I would also recommend if any fathers are out there looking, or even any providers are looking for places to send fathers to, they can check on the Parent Support Network of Rhode Island, and they can find more information about the father support group. And on that note, I'll turn it back over to Dr. Steve.
Mute it. Thank you very much. Whirlwind of information. I want to get to your questions. I just want to make a couple comments really quickly. The first one is what came out loud and clear to me is that by having devoted time, either legislatively generated through the state of Connecticut, or at least through the various departments, as we heard from Rhode Island, and I can speak in my state of Vermont, nothing in the legislature of which I'm aware, but definitely it's a policy push in the state. You give legitimacy to this issue, which actually hasn't had a kind of focused legitimacy to it historically. And there's a whole kind of side note on the literature of fatherhood in the United States where, the wallet is how it has. I'm sure that's how my dad, who I'm very blessed because he's still alive, but I'm sure that's how he thought of himself as the wallet. So when he left at 6 a.m. and came back at 8:30, he was tired, but that was it. That was his job. None of us as dads, I think, see that entirely as our whole job. And most importantly, when we allow dads to expand that role, it's the rising tide. The whole community benefits across every kind of part of society. And I think that's what our speakers really got to. The final thing I wanted to say is there's at least one specific program, I think it's in Connecticut, I'm thinking back to the talks where people come in and they tell their stories in the kind of storyboard. Since humans have talked to each other, they've told stories. That's how we get information across. Initiatives like that, organizations where dads can get together, tell stories to each other, not in a kind of like overly sharing way, but just like what it's like. What are your experiences? What do you recall? That actually moves us forward. And it reminds me, final point, and we'll get questions. There's a trail that I take my dogs to. I spent most of my career in Boston. I'm from Kansas originally, but I spent most of my career in Boston. Came up here, find these trails, take my dogs out. In the middle of the woods, there's a mailbox that someone put in there and just wrote dad on it. And it was about 10 years ago. I've read it because I found it in old newspapers when I was researching, trying to figure out what this thing is. People leave letters for their dads in this mailbox. The letters are heart-wrenching, inspiring. I mean, I always cry when I'm there. Often it's when their dads have passed away or dads who are no longer in their world, but often it's about dads who have come back into their world. Those stories have resonance. So that mailbox, which is a low-tech DIY version of what you all are doing in Connecticut, super important. Those are my out loud thoughts, but I'm curious what questions folks might have. And I think Ash is monitoring the question site for us.
Yes, we are still getting questions. So, Dr. Steve, we can start off with the questions that we have, and I'll let you know as questions pop up. So, requesting all the audience members to drop their questions in Q&A or in the chat feature.
I don't think I can. Can I see them? I don't think I can.
I don't think so. You can see them. I can see it
Okay,
from
so
my
you'll
end.
read them.
Yeah.
Okay.
Yeah, I'll let you know. One question that I have is, what are the common concerns that you see among fathers across the work? What is something that has changed? What trends do you change in the concerns when you work with the father? Go ahead, Ty.
I can briefly state is that most of the time they seem to be lost with the court system. All of a sudden they're put in a situation and then they have to go to court and they have no idea where to go, how to negotiate, and who they need to speak to. And that's one thing that we've started working with RIFI is creating, you can say an encyclopedia of what do fathers need to know. And we're working on creating a document to help them navigate themselves, their way through the court system, where to find the supports they need, who to speak to. And even there's a glossary of terms in there so they can understand what's being said and how to understand and benefit from being at court.
What about that's first of all, the glossary term, just for anything, it's never fun for anybody, but maybe dads, especially for whatever cultural expectations are on us, to not know what we're doing. And boy, it can feel overwhelmed in court. I've been to court for all sorts of different reasons. I don't know where to go. I would love to have access to documents like that, and making that available as a function of the state tells dads that we care about them. And that's a really important initiative. I'm curious what other things come to mind from Tony and Dr. Copeland. Whoever wants to go ahead. Dr. Copeland.
I would say another
Diane,
piece
sorry.
is within this work, it's very tough in terms of trying to be preventative, right? So a lot of times what we see, and I think that's kind of why everyone, especially what we're trying to do cross agency wise, cross state wise, and hopefully globally, is the understanding that a lot of times by the time we've connected with the fathers, there's been a lot of trauma, there's been a lot of negative experiences through. So a big part and a big challenging part is one, validating what their experiences have been, and trying to help them move forward and really trying to be that change when you are interacting with them. It's very, to me, one of the most important parts is allowing fathers to sort of, have that opportunity to speak about what their experience has been, and not be judged for it, not take it personal as a professional, and really absorb what they're saying in terms of being able to help with system change. The biggest thing is really us as a community, us as a whole, really trying to understand that usually with fatherhoods, the first people that when you become a father is you think about your own. And if that experience and if that has not been positive, it's very hard to connect with how to really be successful at the fatherhood position. Then if you add on some of the other, life's challenges, whatever they may be, whether it's court involvement, whether it's financial stability and other issues, it can become overwhelming. And usually the first thing when you're not good at something, that's the first thing you're going to drop, right? So a lot of times that is what you see. So I would say the challenge is trying to peel back those layers and really trying to help fathers gravitate towards a more of a positive outcome and positive lens. But, that requires us as professionals to be able to help them through that.
Absolutely. Diana, I'm sorry, your picture just wasn't on the screen. That's why I didn't say you before, but your hand is up. I can see it now. What do you have?
Thank you so much. So I also wanted to mention, because it's not necessarily a concern from the father perspective, but a concern from us as systems, that many times dads are unaware of what they could avail themselves to with services. They don't know what's out there. And so we as systems, if we're not asking them what they need as fathers, and we're just looking at them in systems where they might be seen as an individual, right? So we say this all the time. When you think about the Department of Labor, which is one of our very strong partners, and they are helping job seekers, right? If we're only helping them from an individual perspective in job search and training, we're missing a piece, because when you're unemployed or underemployed, or you need a better job, you need something with benefits, and you're a parent versus you're not, it's different. And so what we're working on in our state is the questions that we ask and how to get them how do we ask those questions and how do we get them to resources? So instead of asking, just what you need here, we say, are you a parent? Do you have children? And if they do, referring them over to our statewide 211, which is our best up-to-date resource for local things that they might need in their fathering role, not just what they need as a job seeker in front of me right now. Right. So thinking about it from a more holistic way will help any system. Right. So the other piece is our 211 resource. They used to ask when somebody called the contact specialist for local resources, they had a script and they would say, how many people are in your household? Well, that's not a very good question. And here's why. Because if I'm a dad and my kids aren't in my household and I have a roommate or I live by myself or I don't have a home and I'm looking for housing or I'm looking for those things, if you're just asking me the number of people, that doesn't say who I am. If now they ask, are you a parent? And if they say yes and they choose to give that information, again, that opens up the conversation to get them to different resources for their fathering role. That's how you can engage them and better help them to better support and get their needs met for themselves as parents. So that's something that for us has been a work in progress. Some, systems like child support, family court, child welfare, those kinds of things. That's where parenting is there, right? That's where a lot of times we might identify somebody as the other parent, the dad, the mom, the whatever, the residential, the non-residential, or whatever we say in our systems. But for some of those more non-traditional, they're not seen as human services, but they're absolutely dealing with humans, right? So why don't we make sure that we're asking that all along the way and think about this from that parenting perspective? So I just wanted to mention that.
A really good point, because we can't know what we don't know, right? So you gotta ask, and sometimes we actually don't know the questions that will yield the most actionable information. So I'm so glad that you brought that up. Tony.
Yeah, Dr. Steve, I'd like to elaborate on a little bit of what Diana said and also Dr. Copeland. So with regards to what Diana was speaking to, I think as systems have to be really adaptable, right? And we have to meet dads where they are, right? And a lot of times we're doing stuff, we're sending emails and we're sending letters. They're not communicating that way, right? They're in the social media. We have to figure out ways to be really adaptable and get the message to them so they'll know where the resources are. So we have to be very adaptable, and we got to get young kids in there, getting those messages out on social media for us and say, hey, you can find help here. The other thing with regards to Dr. Silas Copeland, what he was talking about, I think definitely allowing the dads to vent and vent their frustration. That is a real thing. They're going through that, but I think it's also important to really keep them on task, right? Because what happens is, a lot of time with the venting, we're concerned about mom, right, and what she's doing and who she's dating, right? And it's like, hey, I think we've all said it throughout the presentation. It's like the children are at the center of what we're doing here, right? So keep that focus on the child, and he can really make some headway that way if he just focuses all his energy on the child and what he can do to make sure that his child is well taken care of.
It's literally the definition of dad. It's about the kids. You don't get the title if there's not kids. So that's why they call you that. And that's why we have to ask. So there's the venting, which matters, has real therapeutic value. People do better, but it's not so great if you don't inch it, say, okay, how is this going to change what you're doing with your kids and in your community to help for the future? Which is, I can't even count on one hand the number of dads I've said who are not interested in that. Almost every dad I've ever met in my entire 26 years of doing this, they want things to be better for their kids.
Dr. Steve, we have Howard who put his question in the chat. Howard, do you want to shout out your question?
Are you asking me?
Sure.
Oh,
Yeah.
okay.
Hi, everybody, and thank you. Feel very proud to be part of the Connecticut team here, and learn about services I wasn't even aware of. So great shout out to Anthony and Diana. Um, a lot of my questions have been answered, but I was thinking about what are those strategies that have seemed to be most effective in actually engaging fathers, because not all fathers are alike. And there's a very broad spectrum of dads when we talk about dads. And I was also curious of how do you determine effective engagement? Like, how do you know when you're successful? How do you measure that? And what are the hallmarks of a successful father's engagement? Anybody?
Oh, what I'd like to say through the father support group. So I'm talking about having support groups where fathers can come and voice. I would believe if anyone, particularly for the last year, would sit into a father support group, they would say, "This is a group of men talking." The sense of vulnerability, sensitivity, the nurturing thoughts, the camaraderie with each other. When I saw these fathers first come in angry, talking about their significant others in negative ways, that has gone. We have now these fathers who are looking forward. We also have a leadership aspect to the support group. Depending on the amount of time that you've been there, you start getting leadership training so you can become a voice for other fathers. So I'm seeing this really growth where fathers are feeling so much better about who they are, even in the situations which may be untenable for them, but they're willing to look at it from all sides now, where initially they were only seeing it as they were the victim. They don't see themselves as victims anymore. They're looking forward for their growth and the relationships they're going to be creating with their children, perhaps family, into the future.
I'd just like to add, I think the education of our community-based provider partners, I think has been helpful for us, for them to better understand the way the government systems have to work, like that are the difficult ones, like child support, and which we are the lead agency for in our state, and we work with our judicial partners on the child welfare system and others. The more that the community providers that are working directly with dads understand the way it works, we know that they are the ones engaging the dads for so many different reasons in their programs because they have such comprehensive, great programs. And then they can share accurate information. That shows us that the dads, while they can complain, absolutely, they can feel their feelings and vent and certain things. If they better understand why certain things happen and they create a voice for themselves within that system, that's where we know our engagement is working better because we don't want processes to happen to them. We want them to engage with us. But the requirements that our staff in child support, I'll say, have to follow from the federal and state guidelines and rules and regulations and laws, the process will happen to you, but what we want to do is engage them better. And we're doing training with our own staff to better sort of change the culture around what this looks like and have them understand why folks are in our system and how they move through and how we're treating them equitably, non-custodial or custodial, right? And so I think education is the key, no matter if you're educating dads directly, educating the providers to support and be those sort of ambassadors in the community as partners with us. We have a state rearage adjustment program for state-owed child support debt that's run through our fatherhood programs that are DSS certified. So they can enroll and potentially get some of the debt that they owe the state whittled down and adjusted if they meet certain criteria. Once fathers know that we're doing what we can to support them in some of these things, the trust is hopefully rebuilt, right? Because for many years it was a very punitive system only, and now it's not that. But people remember, right? And they know what they've been through or what others have been through. Word of mouth is a big thing too. Once you start to see that, if the word of mouth is that they're trying to work with us now and these community programs are helping us, that's a big way to engage men and help them get through sort of the challenges that they're having depending on which systems they're engaged with.
Yeah, and I'll quickly add on to Howard's question around what success looks like, right? And we talked about a little bit about what it looks like at the system level, but as for me as a as a father myself and a professional in this field, success looks like to me is really it's consistency and accountability, right? And like it's we want and we're hoping that our dads develop some consistency with their families, with their children, right? If you say you're going to do something, you do it, right? And as far as the accountability is concerned, if you can't make it, and you call your child, you call that parent to say, "Hey, I can't make it because I'm doing this." And a lot of times, what happens in our fatherhood groups, they are held accountable because the other fathers hold them accountable if they miss a class, if they're not doing what they're supposed to do. So I think consistency and accountability are really key factors in seeing what success looks like with these gentlemen.
Can someone talk a little bit about kids? And some of these fathers have been, disengaged from their families for periods of time, either, by themselves or through external forces. We're talking about empowering dads, but so many of the kids need help as well in terms of re-engaging with a father who's been absent. What are we doing to help strengthen that relationship while we're working with the dads and helping to build up their ability to become more accountable and more responsible, engaged?
And keeping in mind that there's not a kid in the world, whether their dad's much in the picture or not, who doesn't have in mind what they think their dad is. Like that's just part of being a kid. So you've got to sit with the kids with the understanding that they already have in mind who is not there. And we got to help the dads and the kids to reconnect because it's good for everybody. Not only does it make them feel better, it makes the community feel better. But what do you guys think? Our guests, our speakers.
Well, I would say laying out and having a plan is extremely important. A lot of when it comes to bringing a child back in and repairing that relationship, clinical support is 100% the way that we would lean in terms of repairing that relationship. As we talked about, there's a lot of layers, and the challenge, or so to speak, in order to see how that relationship is building, is allowing not only the father but the child to have opportunities to really critically think about what exactly transpired in terms of the relationship, of where in us as providers and professionals being a conduit to that. So our biggest piece around that would be to bring in that clinical support, because that is the safest way in order to repair some of, especially some relationships, especially if there's been state involvement, if there's been a removal, if or if dad has been an absent father as well. The clinical component is what we're going to lean on and allow ourselves to be a conduit through that process in helping them grow. And I see Kelly's hand is up, so I'm going to allow her to also elaborate on that.
Thank you. I just wanted to quickly add one of the components within prevention that we've been providing training and access to different workshops for our case managers that are, embedded in the communities, working one-on-one or in groups with the dads, is understanding a lot more about their own mental health and the mental health of their children. What are some potentially dangerous signs or symptoms? As I said in the very beginning, some of the QPR, the suicide prevention trainings, some of our case managers have become QPR trainers themselves, so they can offer it both to their staff in-house as well as to the dads or externally in the community. So, and the other feedback that we've gotten from the case managers that we're training is their comfort level has increased so much by having this access to these different specific mental health trainings. And they've also learned a lot more what the resources are within each community if they need to make a referral, or, if a dad is bringing, "Oh my God, I'm so worried about my child, I don't know where to go." these case managers now have better access to making that referral. So I feel like what we're seeing just through my very small prevention lens is the case managers have the confidence, and the outcome for the dads is that much better with that additional education and confidence.
Tony, you get the final word here.
All right, so I just wanted to touch on a couple of points here, because Silas hit on a few things, and I like what he was saying around the planning piece, right? Planning and then having some clinical support, but also planning in the respect that, you know, a lot of times when dads are away for so long, right, they don't know what to do with their kids when they're around them, right? So we have to prepare them for that, right? Because it's not, you know, when I see my kid, everything just kind of gels and we hit the ground running, right? We have to teach him sometimes what he needs to do at, you know, for age appropriate games or things like that to do with his child. So that's one thing. But the other piece too is patience, right? Dad has to be patient, and because the child may not open up right away, right? You're expecting this great reunion, and this child hasn't seen you, they don't know you. So you're going to have to build that trust and build that relationship. So have some patience around that, because you can be discouraged when your child is not hugging you back or is sort of afraid or whatever. So really, you know, having some patience and some grace around that particular piece. So those are the two things that I wanted to say. Thank you.
And I know that we're out of time. I want to be respectful for everybody's time. As happens with good people and a really important topic, we could talk for a long time. I want to thank the New England Child Behavioral Health Network for sponsoring this. I want to thank our awesome panelists, and please write to us for ideas for future webinars and also how you felt about this one as well. I hope everyone had a terrific Thanksgiving and have a good set of holidays upcoming. Thanks very much.
Thank you. Take care, guys.